Next speaker, in fact, he is our penultimate speaker. He's also a friend of the family. He's also a practicing GP in the southeastern suburbs of Melbourne. He is also very active in community affairs, and I should mention he runs a very creditable non-profit NGO in Bangladesh which engages in preventative healthcare in rural Bangladesh. I invite Dr. Ahmed Sharif Shuk.
Good morning, ladies and gentlemen, and thanks, Mushfiq Bhai. I'm really humbled to be able to stand before you, and thanks to Lutfur Bhai, his family and friends who have organized such a wonderful event. I find it very significant that we are having this wonderful occasion in the month of March, in which month, as a Bangladeshi nation, our spirit is always at its peak. As you know, in March, we have declared our independence. We started our liberation war. I'll start by quoting a famous statement from one of our bravest freedom fighters. And he said, "There is nothing more precious in life than to possess a fearless mind." Ladies and gentlemen, as we knew Kakon, she fought a fearless fight. She had a fearless mind. And let me pay tributes to her memory today. And Kakon has united us to this occasion even through her absence. What a tremendous lady she was. May her fighting spirit, her beauty, her innocence, her love for people spread among us. Ladies and gentlemen, today possibly not a morning of lot of talks, lot of words, but I think it is a morning of self-reflection. I was amazed by some of the presenters, some of the lectures delivered today, especially the lady who called herself a cancer thriver. We here are thrivers in different ways. Some are from cancer, some are from different adversities in life, and we have a fighting spirit in common, which makes us very unique and very fortunate indeed. I'm not going to add something new to what has been spoken. I think most of the things I wanted to speak has already been spoken. And many of us, I'll just reiterate the things I used to speak in different occasions. Many of us are busy raising our kids and building our portfolios and forgetting why we are doing so. We are doing so things for ourselves. So if we neglect ourselves, our own health, our physical and mental well-being, then these all are mostly futile exercise at the end of the day. And we often keep forgetting those things. Ladies and gentlemen, there have been many discussions happened about cancer. I just like to mention a few other things because I think we are going to talk about our health and well-being without making this event as a program of health talk. You possibly know that as a Bangladeshi, we are one of the fastest growing diabetic population in the world. And in 20 years back, WHO estimated that 14% of our population has been suffering from chronic kidney disease, which will eventually lead us to have renal transplantation or live our life, rest of our lives through dialysis. 14% in a population of 170 million people is a huge number. And we could have prevented most of it in our young ages if we could have done few things right. talk about diabetes. We know that it's a killer disease, and the lifestyle we normally lead doesn't help it at all, especially rapidly urbanized Bangladeshi society, rapidly becoming affluent Bangladeshi society. The kind of lifestyle we lead doesn't help us at all. Talk about cardiovascular disease, talk about heart attack. A lot of you will hear that your friends in their late 30s, early 40s are having heart attacks. And of course, our lifestyle doesn't help at all. We often say in jest that the money, the energy, the time, and the effort we spend preparing our food, at the end of the day, what we prepare, most of it is not worthy of our health. So I'll draw your attention to that. A lot of things have been spoken about pap smear, about breast screen, and so on and so forth, prostate screen. I'd also like to mention about using a simple thing called sunscreen. Please do use it, because a lot of us think that being darker in complexion, we are immune from damage of the sun, which is not true. So please use sunscreen. Make sure that you use it rightly, right amount, because we need to be protected from sun damage in Australia as well. And about our sisters, our mothers, our wives, in a traditional Bangladeshi society, they neglect themselves. We neglect them as well, as husbands, as brothers, as fathers as well. A lot of things have been spoken about the breast cancer. Yes, there is breast screen and so on and so forth. It's true. But the very important and simple thing is to look after one's own breast is very important. To feel it, to touch it, to see it is very important. If you go back to our traditional Bangladeshi community, a lot of people who fallen victim to breast cancer because they have neglected at an early stage and they thought it was just a breast abscess or something. They were too shy to go to a doctor. Please break this barrier. And not only within our community here in Melbourne, let us talk to our friends, relatives back in Dhaka, back in Chittagong, back in Kolkata. Let us talk about them. Let us educate them. This is our responsibility, being an enlightened member of an enlightened society, to lighten our friends and our fellows back home as well. Because we are living in a global village. If my sister in Bangladesh is sick, I cannot have a good life here in Melbourne as well. So this is our responsibility to talk to them. And most importantly, how many of us have our own GP to go and see once a year at least? How many of us have had our cholesterol checked or blood pressure checked in last 1 year? This meeting is going to be totally futile if each and every one of us after the end of today do not take a resolution that I'm going to see my GP to have my cholesterol checked, to have my blood pressure checked, even if I didn't have it in last 1 year. So please do that, because our health, we owe it to ourselves, our children. We often say that we are living in Melbourne, fighting for a good life for our children. But if I do not look after my health, my children will be orphaned tomorrow, and I haven't done any good to them. So let us do that. We have spoken about cigarette smoking. I also like to mention about betel nut. A lot of us, after our traditional Bangladeshi meal, go and have some betel nut, and a lot of us obviously know that it can trigger oral cancer. So I would like to warn ourselves about that. At the end of the day, I would like to pay tribute to the memories of Lamia Khan. May her soul rest in peace. Thank you very much.